Welcome to WMITV News, brought to you by Horn Auto Center on the west deuce of Clubs in Show Low, the Chevy store that saves you more. Here's Laura Singleton.
I'm Laura Singleton from the White Mountain Independent, here with WMITV News in Show Low TV studios. I'm here today with Bryan Layton, Assistant County Manager for Navajo County. He's going to share with us some recent information about COVID-19 and how the county is working with the County Public Health Department to keep us all safe. Welcome, Bryan.
Thank you for having me.
Thank you. So my first question is, can you tell us how many people have tested positive for COVID-19 in Navajo County, or how that process works? I understand there are state lab testing and there's private lab testing, so can you elaborate?
We've had over 100 people be tested through the state laboratory. That's only part of the total number of people that have been tested. Fortunately, we do have private laboratories here in the state that are partnering with us and our resident physicians to test. So the state lab has tested about 100, but there's probably 3 to 4 times that number that have been tested overall through the state. We will get confirmation if there's a positive test.
So is one of those private labs one of the ones in Tempe that was recently announced that activated?
We've had several activate recently, and we're really glad to have those partnerships online for us, because it's really, really important that we can get those tests done and done quickly.
Do you know how many test results are pending out of maybe those 100?
We've tested about 100 so far. We're waiting on 50 more. That's just from the state laboratory. And again, there's probably 3 to 4 times that number pending in our private laboratory partners as well.
Okay. Can I ask what the turnaround is right now for test results?
It can be different depending on which lab you use. With the state laboratory, we're usually on a 24-hour turnaround.
We know there are some confirmed cases of COVID-19 in southern Navajo County, where for a time there were only cases in the northern part of the county. Do you think this will help people take this more seriously, maybe kind of ramp up precautions?
Yes, I think we are seeing residents take it more seriously, and that can be a good thing if it translates into positive behaviors. And positive behaviors in just maintaining a good physical distance like we are, washing your hands thoroughly, cleaning doorknobs, countertops, phones and tablets at home. As we see those behaviors increase, that's a really positive sign for us.
Going back to the Navajo Nation for a moment, how is Navajo County helping the Navajo Nation with the cases they have now, whether it be with supplies or support systems?
Absolutely. That's a daily partnership. We have daily phone calls, conference calls with their emergency operations teams. But like you said, the most important partnership is with our infectious disease nurses. And so that partnership with their counterparts on the Navajo Nation is really important, as we lend support to each other and help each other out.
Do you have daily conference calls or anything like that to kind of review what you've learned, what you know, what's changed?
Absolutely. Not only with the Navajo Nation, but we have daily conference calls with the governor's office. We've had several conference calls with our senators and representatives as well, and also with other counties, county supervisors, as well as county public health district managers and directors as well. Those are going on constantly.
Okay, and I understand with Apache County being an adjacent county, there's so many things and information that you're probably sharing for consistency. So let me ask you, knowing that, what's the average day like at the health department and at the county office?
Well, with county offices, it's a little different. County staff are still coming to work, but they interact with the public much differently. We are closed for public access, but we are open for interaction through email, by phone, over the website. So county staff are still in their offices working, but they're maintaining good social distancing. We've staggered shifts and whatnot. They're still available, but it's going to look a little different. Mm-hmm. For public health staff, the days are long, especially for our nurses. They are investigating all the time. They're on call all the time. They're working days, evenings, and weekends. And that's probably the most important function that we can or role that we can play for the community right now, is those in disease investigations and what's called contact tracing. So when a physician calls us and says that they suspect that someone might have the virus and that they'd like to test, we get involved right then. We don't wait for a positive test. Our nurses get involved right then. So they talk to that person, they find out where they've been, who have they been around, who have they talked with, and if there's risk of exposure at that point, then they call that person and talk to them and see how they're doing. We give them instruction, and then a lot of times we follow up with them twice a day for about 2 weeks. So we're in constant communication with folks that are at risk of exposure or think have been exposed. We make sure that they're feeling well and that they're staying quarantined and they're being safe.
Okay, and then do you ask them if they have other people that they may have come into contact with, and you kind of try to complete that loop?
Absolutely, that's a real key part of it. So if you've gotten a call from one of our public health nurses, then you've been identified as a person that may have had exposure or some level of risk there. That personal communication is so important, so they can take it seriously, so they can take steps in their lives to make sure that they're being safe, that other family members are being safe as well.
Excellent. How many public health nurses are there?
So right now it's really all hands on deck. We have 2 dedicated public health nurses that specialize in infectious diseases, but we have about 6 total nurses, and then we have some contract nurses, and everybody's pitching in and everybody's helping out where they can.
So when you say a long day, are you talking a 10-hour day, a 12-hour day? Are they rotating?
Oh, absolutely. Yes to all of those. So it can be a normal day. This past weekend, I think they worked every day this weekend. Oftentimes they're working in the evenings too. A 10-hour day probably seems like a short day for them now.
There are some rumors circulating, and they have to do with possible cases or presumptive positive cases of COVID-19 in southern Navajo County and possibly southern Apache County. I'm not sure. Can you talk a little bit about that? I know you have protocol that you have to follow.
So the large majority of cases that started on the Navajo Nation early on, but we have had community spread. And the Arizona Department of Health Services came out just a couple of days ago and said that we need to assume that the virus has passed through most all communities at this point, whether you realize it or not. I think some folks mistakenly believe that they can protect themselves by knowing exactly where a case is and avoiding that area. That's, unfortunately, that mindset is not helpful, it's not safe, and it's misguided. We all have to take precautions whenever we go out. Doesn't matter to a grocery store or another type of business, you need to be protecting yourselves. And these are really simple things, right? It's washing your hands, being aware of what you touch, and most importantly, remembering not to touch your face. Supervisor Whitesinger this morning shared that this is a virus. It does not have legs or wings. It doesn't move around on its own. It's spread by people, and most often it's by touch, right? So maintaining that distance, being aware of what you're touching, not touching your face, washing your hands thoroughly for at least 20 seconds. The soap and water will wash your hands and clean your hands. Disinfecting doorknobs. Oftentimes when we go to a business, when we walk into the store, we'll pull out our phone, right? As we're touching a cart or touching products. So maybe remember, when you're getting out of your car, put your phone in your pocket and leave it there for the entire time you're in the store.
That's good advice. So can you talk about, does the Navajo County or the health department have a stance on the public wearing masks? Is there something you recommend?
Well, the CDC hasn't recommended that everyone wear masks yet. I think you need to individualize that recommendation and see what's best for your situation. If you have, say, disposable gloves as you're touching a cart or touching products in a business, that's a real common sense and easy way to protect what you're touching, and then you just remove those gloves. Masks, regular cotton or surgical masks can help if you have symptoms. That can help prevent you from spreading as much to others. So in that case, that would be advisable and good to do, is wear a mask if you're feeling those symptoms.
Okay. And someone should always, they can check with their provider, check with one of those facilities, whether it be urgent care or Summit Cares or some other physician that they see, and ask them, especially if they have an underlying health condition such as asthma or COPD or diabetes or something of that nature.
Yes, if you're not feeling well and you feel those symptoms of shortness of breath, shallow cough, and a fever, call your healthcare provider, or call a telemedicine option. Summit provides a telemedicine option as well. Call a provider, talk to them, and they will give you a recommendation to either stay home and rest or come in and see a provider. But calling ahead is really important. That way your provider can make sure that they're set up and they're ready for you, and they're taking precautions to keep themselves safe as well.
There may be cases that they're not aware of, and so we need to protect ourselves. I don't know the best way to say that, but maybe you can.
If you can, stay home. But get out if you can, in open spaces, get some exercise, be healthy, but take care of yourselves. And part of that is we're concerned that some folks are going to try really hard to protect themselves and quarantine in their homes, but they're not going to ask for help when they need it.
Protecting one another's privacy. Can you just touch on why the health department cannot give out who has maybe tested for COVID, who is waiting for a test? Not everyone knows what the Health Insurance Portability and Accountability Act is, which is HIPAA. If you'll just explain why that's so important.
Sure. It comes down to federal law and individual privacy, and there are very strict protections on that. So when we have a very small number of cases of individuals, and in consideration that we live in very small communities too, where a lot of people, everybody, and word
Sure.
gets around really fast. And so by giving too much detail, we could accidentally identify someone, and that's a clear violation of federal law. And so it's a real careful balance that we have to try to achieve, right? Because we need to let the community know that this is happening in the community, but also respect that person's individual privacy, their right to privacy. Mm-hmm. So, and again, that's why we go back to, we need to assume that it's all around us anyways. And at this point, it really doesn't matter if it's in this community or that community or not. It's spreading around.
Bryan, tell us once again how to find the Navajo County Public Health Department dashboard.
Certainly. There's a couple of different ways you can do it. Go to the county website, which is www.navajocountyaz.gov. And right at the top there's a link to the dashboard. You could also just put in navajocounty.gov /coronavirus. That'll get you there as well. Or just in your search bar on Google or whatever search provider you use, if you put in Navajo County and coronavirus, it'll come up as well.
Thank you, Bryan, for sharing this information with us, and we will continue to share your press releases from the county and the health department on our website as well. Thank you for watching. I'm Laura Singleton.